And I'm here to talk to you about many different careers in the diagnostic field. Again, it's another healthcare profession. And I know that all of the healthcare professions are trying to entice you to come and join them. And it's because, you know, the baby boomers are retiring and there's lots of opportunity. So I'm just here to hopefully tell you why professions in imaging and laboratory would be good careers to choose. I can tell you that I am trained as a laboratory technologist. I took my training over 30 years ago, and I've now transitioned to work in human resources. And if I had the choice, I would do it all over again. And it's a very rewarding career, and it's constantly changing. So I don't think if you made a choice to come into healthcare in any way, shape, or form that you would regret the decision that you made. So again, you know, I've sort of said that the careers are challenging. They're very secure. As you know, there's always, unfortunately, sick people. So when you choose to work in healthcare, you don't need to worry about the economy booming or the economy boosting. You're always going to have a job, and you're always going to have, your work is always going to be in need. They are very stimulating and rewarding, especially if you want to, if you have a sort of a need to help people. The healthcare fields are very attractive for that. There's a lot of flexibility in these in these careers, so you can choose to work in you know, a particular area, or you can work in areas where you're going to use a broad range of skills, and we'll talk a little bit about that. They are very challenging. It's constantly changing. It's very high tech. I don't know what I can say, but hopefully I'll give you more information along the way that will help entice you. So I'm going to start with the medical laboratory technologist. So that's the name of the profession. Professional is a medical laboratory technologist. The program itself is called Medical Laboratory Science. And these are the healthcare professionals that perform all the testing on samples that are taken from your body, be they tissues, be they fluids, like blood would be the most common fluid, urine, other bloody fluids such as CSF. And they do this to detect diseases and monitor treatments. And 80% of the information that physicians use to make their decisions for treatment and actually tell you what's wrong with you come from the laboratory. So it's a very, very important career. It's not as patient interactive as some of the other healthcare professions. So if you want to help people, but you maybe don't have the need to want to be around people who are sick every day, 8 hours a day, but you like science and you want to help people, this is a great profession to consider. So you have to, again, like I said, you have to like science, and these are all of the different areas that you would end up studying as part of your program. So the program is very intensive, and you have to like science. It's a 2-year program. 1 year is spent at Red River College, and the second year is spent actually in a hospital, rotating through all these different laboratory areas. So I'll just sort of briefly introduce you to all of them in case, and you may be familiar with some of them, but biochemistry is the area that really looks at the analysis of chemical and hormonal changes within the body, including toxins and drugs. And sort of some of the more common testing that is done in the area, or that you would be familiar with, would be glucose testing for somebody with diabetes, or something called troponin, which is an enzyme that's released when you have a heart attack. So those are just very common things, but they also do, like I said, the drug testing, so alcohol testing, those kinds of things. If somebody has been drinking and driving, those kinds of samples are sent to the lab as well. Diagnostic cytology is the study of cells taken from the body, but to determine whether the cells are cancerous or malignant or normal or reactive. So it's basically focused on cancer detection of cells. Clinical genetics is the study of chromosomes, DNA, RNA, to diagnose genetic diseases. So be they something like Down syndrome, where you have additional chromosomes, or minute defects at the cellular level, which are also due to usually minute DNA or RNA mutations. Hematology or hematopathology is the study of the production and function of diseases associated with blood cells and blood-forming organs, so the bone marrow. So you have within your body circulating white cells, red cells, and platelets, and you in that course you end up studying and learning about all the different diseases, all the different types of anemia, all the different types of leukemias, and those types of diseases, and being able to recognize those and the testing involved in those. You also look at the testing involved in people who have bleeding disorders, so hemophiliacs, as well as people who have thrombosis or clotting disorders like strokes, and heart attacks, which are a clotting disorder. Immunology is the study of the body's immune system, including its structures, functions, and disorders. And the testing in that lab is involved in autoimmune diseases such as rheumatoid arthritis, and as well as acquired diseases such as AIDS and allergies and those types of disorders. And they also do some additional diagnosis with relating to specifying types of lymphoma and leukemias. Microbiology, you're looking at samples to detect disease-causing microorganisms, such as, so you study bacteriology, you study parasites, you study fungi. So all the different bacteria, fungi, and parasites that can cause disease, you learn to recognize them, detect them, and also let the physician know what antibiotic is best used to treat them. And that lab area also is involved in monitoring what they call hospital-acquired infections. So you may have heard a fair amount in the news about MRSA or VRE, which are antibiotic-resistant bacteria, which are sort of being spread within the hospitals. Pathology is the study of tissues removed from the body for the purpose of detecting cancer or other major disorders of organs, systems, and transfusion is the production of blood products, as well as the cross-matching and typing of blood if you need a blood transfusion. So what does a medical laboratory technologist do for the day? Well, part of their day may be spent actually collecting the samples. Sometimes there are other healthcare professionals that assist with that, but depending on the site that you work in, you may actually have to go out and collect the samples, and that's called phlebotomy. You would learn how to package samples safely for transport to other sites, as some testing, some of the specialized testing is done in sort of large referral labs. You would be responsible for preparing the samples for testing once they're collected and arrive in the lab, registering them in the lab information system, preparing your reagents for testing, actually doing the testing, and then once the results are generated, just making sure that the results make sense for the disease process and that there's been no errors in the testing process. You're responsible to set up, calibrate, and maintain highly complex and computerized equipment. These instruments can be as big as the table in the front table here, and generate up to 1,000 test results in a minute. Like it's very fast. So you have to be able to multitask. You have to be able to recognize urgent results or life-threatening results coming out of the instruments and communicate those immediately to the physician. And you're also involved in some applied research where, as techniques are developed in a research lab or new analytes are I guess recognized, then they will start to bring them into the clinical lab, and there's testing that's involved there. Some of the specialty careers in the area, I did mention a cytotechnologist, where it is a specialty career where it's a separate training program where they spend their whole 2 years, I guess, learning to detect cancerous cells from non-cancerous cells from all different sites in the body. So that's a special program. And the clinical genetics technologist, again, specializes in the genetic analysis and the molecular techniques and the mutations. So that is a separate program from the general program. There's also a pathologist assistant, which is a master's level program, so you could go on from just your technologist level program and take a pathology assistant course. And they're involved in the surgical and autopsy specimens, so they dissect those specimens and look at the specimens to determine what area of the specimen is the pathology being shown on a macro level, and then cut a small part of that large organ and send that part off for more cellular detection of the disease. As a medical laboratory technologist, you have a variety of places where you can get a job upon completion of your program. You can work in hospital laboratories, you can work in private doctor's offices and medical clinics. You can work in the research laboratories. There's usually a provincial lab. Here in Manitoba, we have the Federal Virology Lab, which is also an opportunity. You can work in commercial and industrial laboratories, so food processing labs, labs where they're actually making reagents for the equipment and the testing processes. The RCMP Forensic Lab is, I have lots of people who come up to me who are interested in working in that lab. Especially with all the CSI programs that have been on television. And then you can also sort of branch out into management, education of the programs, and sales of the equipment and the reagents. So I'm just going to switch now to the imaging disciplines. So the professional is called a medical radiologic technologist, and they operate radiation emitting equipment, such as X-ray machines and CT scanners, to produce images of the body, again for the purposes of detecting illness and injury. Now, these individuals have a lot more direct patient care contact, and so they actually have responsibility for the patient's care when the patient is in the X-ray department or the imaging department. They have to be sensitive to the patient's needs, and they also have to be acutely aware of minimizing radiation dosages while attaining quality images and reducing the number of repeat images. So again, they're responsible to operate a wide variety of radiation emitting equipment. They're responsible to calibrate and maintain that equipment and perform quality control procedures on that equipment. And they have to perform their examinations with the patient's physical protection, comfort, and privacy as their focus. Some of the different areas of study within the program is, besides the general X-ray radiography, is angiography, which is basically there is a contrast medium injected into the veins and arteries to basically demonstrate the vessels and the heart chambers to detect blockages. Bone densitometry looks at, uses X-ray, low-dose X-ray images, and they're looking basically to see how dense the bones are and how, whether the individual's at risk for osteoporosis or fractures. A CT scan is basically, they take multiple images in a particular plane, and that allows for 3D imaging of the disease processes, or looking like in sort of multiple sections of like cutting through a piece of meat. So you'd see multiple sections of a disease or an abnormality. Fluoroscopy, again, uses contrast medium, is either swallowed like a barium swallow or a barium enema, which would allow you to see GI abnormalities, looking for polyps or blockages again. And mammography, again, is a specialized X-ray dealing with looking for detection of cancer in the breast. Some of the specialty careers in imaging is the ultrasound technologist or the sonographer, and this is a post-diploma program, so you'd have to complete a previous program before you could go into this program. But they specialize in operating equipment that uses sound waves to create images, and again, the most common use for this would be in prenatal testing and detecting prenatal defects in the fetus. And then there's also the magnetic resonance imaging, or MRI technologist, is a post-diploma program as well, and they specialize in operating equipment that utilizes a magnetic field to create images. And they actually, the MRI can see both the hard structures and the soft structures in very, very, very detailed manner. So medical radiologic technologist or ultrasound technologist or MRI technologist can work in hospitals, medical clinics, research, management, education, and again, sales of the equipment and the mediums. So what is the earning potential? All of these positions are union-based positions. So the salaries are what the current salaries are for the union, and these are regularly negotiated, and so as part of a union, you don't need to worry about negotiating your salary. At least within the public sector. It might be different in a private sector. If you're working in a private clinic, the salaries may not, like the positions may not be unionized. But because of competition, I would say that they have to keep pretty close, because otherwise, it's going to be more attractive to work in one area versus the other. So an entry-level technologist would make about $53,000 a year right now. And there's multiple steps on the scale. So you automatically progress through those annually with each year of work. And so by the time you put in 10 years of service, the average working wage is about $68,000 a year. And if you go into management or senior level positions, the potential is to make anywhere from $85,000 to about $100,000 a year. Some of the specialty careers, which have added education requirements, like the pathology assistant, ultrasound, MRI, the salary scales are a little higher. So they start at around 60, and they go up a little higher to around 83. Or 75. So those are current scales that I took out of the contracts as of 2012. So how do you take these programs? Well, both of these programs are offered at Red River College. They're what we call 1+2 programs. One, because there is a prerequisite year of post-secondary courses that are required before you enter into the diploma program. The diploma programs are 2 years in length. They're 2 consecutive years, so you don't get a break. So once you start in your September, you're going to go right through to the following June or the following August, depending on the length of the program. And there is the option to do a degree completion at the end of the completing the program, pending funding. The university has approved the programs, but the funding is still pending. So what are the prerequisite requirements? For the Med Lab Sciences, there's a specified 24 credit hours that are required, and I'll go over those. And for Med Rad, there's 27 credit hours, so there's one more course that's required. And you're also required to do an occupational familiarization, where you spend a day or two job shadowing a laboratory technologist rotating through the areas, or an X-ray technologist rotating through all those areas. And that's just to make sure that you're familiar with what the profession is about, what the work requirements are, and to make sure this is something that you think you're interested in. So the 24 credit hours for Med Lab Science, you're required to take anatomy and physiology at a university level. You're required to take a statistics course, 6 credits of chemistry, 6 credits of biology, and a university written English requirement. For medical radiologic technology, the credits are very similar. You have to take, again, the anatomy, physiology, the stats, but instead of the chemistry, you have 6 credits of physics. Instead of biology, you have sociology, and then 3 credits of chemistry and the written English. Recommended for high school, again, depending on which program you're taking. We recommend the pre-cal math, but it's not an absolute requirement. You can get into this program with an applied math, but there is a lot of math, so you should know that you have to be fairly strong in math for both of these programs. In order to get into a university level chemistry course, you have to take university entrance high school chemistry. So that is a requirement for both programs. If you are interested in the MRT program, you have to take high school entry level physics in order to get into university physics. The biology is an optional requirement for lab. You actually can get into university biology without having taken a biology course. So that one isn't actually a requirement. Okay? And this information is up, well, I guess this information isn't on the Red River website, but it does tell you if you go to the universities what prerequisites you need, but this would be the recommendation. So I'm just going to switch gears here because as an organization, we are in need of laboratory technologists and X-ray technologists and ultrasound technologists. So we have put together a sponsorship program where we'll actually cover the costs of training for these programs. So I'm just going to go briefly through that. So it is a benefit to you and just something I'd like to make you aware of. So Diagnostic Services of Manitoba is a relatively new organization. It's been around since 2002, and it basically is responsible for doing all of the laboratory services in the public sector. So that's all lab services in all hospitals across the province. And outside of Winnipeg and outside of Brandon, we're also responsible for all the imaging services. Okay. So we're the largest employer of diagnostic professionals in Manitoba. We have about 1,600 dedicated staff, and we provide service at 79 sites across the province. So it includes, again, the large labs. That our largest labs would be at Health Science Centre St. B and Westman Lab in Brandon. And all of the in rural, what happens is the lab and imaging services are combined, and quite often the staff that are performing or working in those areas actually do both, are able to do both lab and imaging functions. Not in all sites, but in some of the sites they can. So the staff are cross-trained in both lab and imaging. So our sites are all the way from Churchill at the very top to Altona, which is our most southern. And although of the 79 sites, only 10 of them are north of Dauphin. So most of them are, the 89 are like Dauphin and lower, and from, I would say our most eastern is Pinawa, and then our most western would be Verdun. And when we're looking at our labor profile, we have about, this number's a little old, we probably have more like about 800 technologists now. The majority of them are lab technologists, and that's because of the large labs in the city and the lab in Westman Lab. And our DI, our number of diagnostic imaging technologists is less, but you'll notice that a lot of them are cross-trained, okay? So we have a lot of cross-trained technologists as well. Right now we have 35 vacancies across the province, and 20% of our current staff are eligible to retire today. And that would equal 147 vacancies across the province. So although the training programs are available and they graduate 30 to 35 individuals a year, the supply is not meeting the demand. So technologists are in high demand province-wide, and we do go out of province to try and recruit technologists as well because we need to. We can't hire all the graduates. And I would say that this, when we look to the future, when we look at the number of people that will be retiring, we don't see this number becoming lower anytime soon. So I would say for the next 5 to 10 years, this is going to be our reality. And this creates a lot of opportunity for people coming into the profession because it means that they'll have opportunities to move up into more senior positions more quickly. Again, because most individuals who attend this program or attend the Rotary Career Symposium are from Winnipeg, I want to talk very briefly about practice in rural. Again, I did mention the diversity of scope and that you would have to do both imaging and lab tasks. And there's also diversity in scope in that you're responsible, these are very small teams, so you're responsible for the managing, the ordering of the supplies, the scheduling of the work, and to actually delivery of service. In the smaller units, you're very closely linked to the healthcare team, so the nurses, the doctors, the respiratory therapists, the physiotherapists. There are, outside of Winnipeg, and especially if you're looking at the northern areas, really enticing recruitment and retention bonuses. So, for example, if for someone who's interested in working in Burntwood or Norman region, they get an extra $10,000 a year just for working in a site in that area. There's also a great earning potential outside of Winnipeg and Brandon, and the reason for that is in the larger centers, service is available 24 hours a day, 7 days a week, and staff have to work shift work. So we have staff in the labs 24 hours a day. Outside of the city, the schedules are usually more Monday to Friday, 9 to 5, and then staff are required to be on call in case of an emergency comes available, and then if there is an emergency, they're called in for the work. So when you're on call, you carry a pager and you're paid an hourly, I guess it's a reduced hourly wage for carrying the pager. And when you're called in, you're paid at overtime rates. So that means time and a half or double time, depending if it's your first call or your second call, etc. So most technologists working in rural Manitoba actually make over $100,000 a year. So it's a great way to start a career. Okay, so I just want to talk to you about our recruitment strategy related to the educational sponsorship. So basically, we pay for you to take your lab or x-ray program, and we also provide you with cross-training in lab or x-ray upon completion of the diploma programs. This recruitment strategy is really targeted for rural, for individuals to return to rural, so that's why the cross-training is provided, and you're guaranteed full-time permanent employment upon graduation. So what does it look like? You end up with $8,500 for a 3-year return of service commitment. So the students still have to meet the eligibility requirements for getting into Red River. You're placed in a facility determined by DSM, but we do intend to match you to your region of preference. We can't obviously guarantee an actual site because you enter into this sponsorship 2 years before you graduate, so we can't say that we're going to have a vacancy in Steinbach, but we could say that we will have a vacancy in Southeast Man, which is composed of 4 or 5 different sites in that region. Again, the additional cross-training is provided free of charge, and while you're taking that training, you're paid your full-time permanent wage. So again, it's a sort of a benefit. Some of the other retention strategies that we have to try and retain the staff that we have is we're providing a lot of continuing education for our staff. We're regularly and constantly reviewing work-life issues. We do employee satisfaction surveys. We try and get feedback from our employees on how to improve services. There is province-wide mobility with the organization, so if you were interested in education sponsorship, but you maybe had family in a particular site, but there was only a spot available across the province, you're not bound to that site for the duration of your career. You basically are required to put in your return of service within a region, and then you're free to move anywhere within the organization to any one of the 79 sites. without losing any benefits, without losing any vacation entitlements or any of that. We have also a lot of opportunity for promotion and advancement because as a single organization, we've had to create many specialty positions. So we have IT specialists that work with our lab information system and radiology information system. We have point of care testing specialists. We have specialists in each of those lab disciplines that we mentioned. And we have imaging specialists in all of the imaging disciplines. And we also have a team of quality professionals. Again, it's a time of change and opportunity. We're putting in a new provincial radiology information system and lab information system. The technology has to be standardized because all of the results from all of the imaging procedures and all of the lab tests has to go into the electronic patient health record. So everything has to be electronic. And there's going to be a lot of staff turnover, so a lot of opportunity for advancement.